Cloud. Okay, we should be all set. Joseph, over to you.
Okay. Um, Before I do screen share, I put some information in the chat just so it can be saved, but my name is Joseph Odell. I am the data scientist for the Environmental Public Health Tracking Program. It's a newer position for the program. Um, I think Stephanie might have maybe attempted to start getting this position when she was still with the program, with the New Mexico Department of Health. I've been in this role for a year now, but I've been employed by the Department of Health for over 8 years in total. I was previously a community health epidemiologist with one of the regions. And yeah, one of the primary duties of my position is to coordinate data from that's collected, managed, and reported by the New Mexico Department of Health, and prepare it in a way that is um, to be used on our publicly available free to use websites. And at that time, I will now share screen. Let's see. Okay. And let me just try to move this bar out of the way. Okay. Do you see a website that says New Mexico Public Health Data Portal?
Yes, it says New Mexico's one stop for health data.
Fantastic. So that's it. That's this is our new portal, our new website. Um, this is, if you are familiar with what used to exist, I'm going to just change tabs very briefly. Um, the Environmental Public Health Tracking Program is a program funded by CDC, and one of its requirements is to have this publicly available website or portal that gives access to certain pieces of data and information of health and environmental information. Um, and then so we had this website as the New Mexico Department of Health. It was nmtracking.gov. And then we have what's referred to as a sister website. It's New Mexico IBIS, or the New Mexico Indicator-Based Information System. This site, IBIS, is still live. You can still access it, still has all the data. And the goal of the portal, as I navigate back to this new portal, is when the full rebuild project is complete, all the content from both of those websites, NM Tracking and NM IBIS, will then live at this one URL, this one website, the New Mexico Public Health Data Portal. So what is currently published at the moment is all of the content that did exist on NM Tracking. So this was phase one of the project. So it is still in active rebuild. So there will be more content that will be available at this same URL. Potentially, I think the timeline is in the next year. So everything that I'll be able to show you, and I think a lot of what would be relevant for the work of Healthy Climate New Mexico is currently live and available. I did put the URL, and it looks like it's been repeated in the chat, but we'll make sure that everyone has access to it. So yeah, so this is the landing page. And the way that it is organized is we have these tiles on the landing page. We have county reports, we have health topics, we have indicator reports, and query data sets, and I will go over all four of those. You can click on any of these tiles and it'll take you to another navigation page. You can also navigate here on the left side of the screen. It's the same groupings: county reports, health topics, indicator reports, and query data sets. I'm going to start with query data sets. It's our most robust method of viewing data. So when you click on query data sets, it'll take you to this next page. We have our New Mexico Environmental Public Health Tracking logo and a tile. You'd be able to click on this. And again, that content, when it's finished post phase two for IBIS, will be at this tile. So we'll click on our Environmental Public Health Tracking tile. And it takes you to all of our information that we have available, all the data, and it's categorized either by health or by environment. And so within all of these, again, you just continue to navigate to data of interest. We have frequently been talking about heat stress, so that's what I'm going to use as my example. So we've gone from home to query data sets. We've chosen NM tracking or the environmental public health tracking, and we'll click on heat stress. And from here, this is where we get to our primary data visualization. We call these query dashboards. And when it loads, so on this query dashboard page, we have access to emergency department visits, hospital admissions, and deaths, all as they relate to heat-related illness. And if we want to change topics, we would click the Back to Datasets button. But at this page, our default view will be our emergency department visits, and it'll have our titles. It'll be showing you what you're looking at in terms of like the data measures. We're looking at counts. Thank you. We like the maps too. It provides a map. We have different ways of showing geographies, either by county or you can click on health regions and it'll be dynamic and it'll show the New Mexico Department of Health's 5 health regions. The map legend will be labeled. So again, just like reinforcing what you're looking at, the number of heat-related illness ED visits. There will be a corresponding table associated with the maps. So again, we're looking at region. If I toggle back to county, it'll then show the table for each county. We're looking at our county and our number of visits. And when you come to a page, default view will be all of the years that are available. So from this, in this kind of navigation pane to the left of the map, we can click Set Filters. And from here, you as a user would have the ability to then select individual years of interest. So we could say we want to look specifically at 2023. You can choose specific month. We have 5-year age groups, so all the way from 0 to 4, and then every 5 years till 85 plus. And again, you can choose multi-select. We can select any of the combinations that you're interested in. We have the Clear All Filters button, which would then reset us to our default. And then again, just kind of still going through what is available. We have our standard race and ethnicity groups as presented by the New Mexico Department of Health. Sex, and then again, county, you can filter by county and by health region. And everything's dynamic. So as like we were kind of looking at, I can look at a couple years. I can come look at, I already showed you some, I'm interested in maybe American Indian or Alaska Native and Hispanics. And everything that you'll see the map changes. If you kind of see the bottom of the table, it changes. So every time you make a selection in this filter pane, everything is dynamic. The map will update, the table will update. And then additionally, we have map view. You can also, on this first navigation page, you can then toggle to chart and table, which instead of looking at a map, you'd be able to look at a bar graph, displaying, and this is going to be your first grouping. So right now we're showing by county. So then all those variables that we just looked at for filters, you have the ability to then display by, so we can say display by year. So this would be, we're looking at all of New Mexico grouped by year from 2010 through 2023. And then again, still without having to leave the page, right? Everything we've looked at thus far has been a version of a count, but we can then go look at crude rate, which would be the number of events over the total sum of population over those years. But we also have the ability to toggle, and we've been looking at ED visits. Without leaving this page, we can then go between ED visits to hospital admissions to mortality. So everything is all available at, on one screen. And one additional part about the queries that I'd like to show is we have this I button towards the top. It's the click here for more information. You can click it, and it's what we refer to as our technical notes. So if you're interested in maybe, where the data came from and having links, so hospital admissions comes from our Bureau of Vital Records and Health Statistics, or if there's any kind of death certificate data or population estimate information. So the technical notes is kind of the nitty-gritty data information if someone's interested about definitions or where the data came from, or if there's any issues with the data, you can check there. Before I navigate anywhere else, I'll pause for any questions thus far.
I have a question. Why purple?
Purple is our primary agency brand color.
Oh, God. That's right. Okay, thank you.
Yep.
Uh,
Our colors are purple and orange.
so weird.
Yeah, yeah. So there'll be a lot of purple throughout this. So
Another question. So this, are we looking at rate? Okay, so we're looking at crude rates on this table. Do you have the
yeah,
data behind the rates? Can you scroll down?
yeah,
Okay. Okay. All right.
yeah,
Great. That's great. I love
yeah,
that. And the footnotes are there. Good.
yep, yeah. So thank you for kind of helping remind me of stuff, Stephanie. So I'll just toggle back to count. So when you're looking at count, it's just showing you like how many of these events happened. You have the ability to kind of work with the time component. If we go to crude rate, right, we're looking at the number of events, but we're now including um, the number of people in that time frame. So we still have our number of, right now we're looking at hospital admissions. So we'll have this column would be identical to that count table that we just looked at, but we're now also looking at the rate per 100,000 people. And we're also including a population estimate. So like, again, we're looking at a lot of years. I'll filter to one specific year so it makes it's a little bit more easy to follow. So in 2024, we're looking at a single year. We have our number of heat-related illness hospital admissions. We have the number of people that live in Bernalillo County. We then provide an estimate of the number of admissions standardized to kind of a certain population figure. So that way we can then compare all of the counties to each other, right? So, and yes, there is a footnotes column. So you'll see, it'll say footnotes. That's just the label. You'll see some symbols. And then, yeah, underneath the table, we provide some justification to what those symbols mean. So one um, pound sign is saying that the rate is not super stable. And then 2 pound signs would mean that it's um, has a relative standard error greater than a certain statistical value, and that it should not be used to inform decisions. So then it says that you should try combining years, which we can then be in our year filter and go combine a couple years, and it'll then just help with the reliability or the help our rates not be so variant year to year, and so you'll have a number that can be compared with a little bit more confidence. And all of the tables throughout queries, indicator ports when we get there, in this kind of upper right-hand corner, there's this little 3 dots. If you click that, you can then export the table. So all of the data that will reflect any of your choices in the filter pane, you can download, and it'll download as an Excel table that you can then use however you want. And I think briefly, I'll just go over, certainly not limited to, but just kind of thinking of what might be my gut reaction over thinking about healthy climate, right? We just looked at heat stress. I think cold stress might also be a frequent topic for you. So for heat stress, we had ED visits, we had hospital admissions, we had mortality. It'll be the same for cold related illness. If I click on that one, same exact capabilities to look at maps or charts. You have the ability to look at different combinations of variables. You might be interested in maybe either asthma or COPD as it relates to climate related conditions. We also there are air quality. There are certain air quality measures that we track. There are a limited number of air monitors that we use. These are EPA certified air monitors. So not every county has one, so they're not always the most full of tables, but we do try to provide documentation about we provide data where it is available, and if it's not, then we try to indicate that there are no monitors. Yeah, we don't. So there is not currently the ability on this portal to be able to combine the air quality and an asthma, but again, we have the download feature, so you could try to look at the counties where air quality monitors exist, and you could kind of be able to look at the trends of asthma ED visits or asthma hospital admissions over those same time periods. So the data is available for you. It's just being able to combine the two is not immediately available on the portal, but the data itself can be accessed and utilized. Yeah, so these are queries, and they all generally have that structure of can you link? Yeah, can you when you say can you link air quality and temperature levels, like the URL link, or
No, I mean, like, could you look at the number of, so yeah, when you say air quality data, is it just reporting what the EPA monitors were reporting that day? Is that right?
yeah,
So
they're
does that,
annual averages or percentage of
I know.
days above a national threshold.
Okay.
So
So it's not broken down to like a daily level in this data. It's kind of averaged over the year
not
and a
not on the
percentage.
portal. We don't have that granularity available. Though it might be um, um yeah, I don't want to promise anything, but you could certainly reach out to us and we can see what we could help provide. But it's not immediately available on this portal that way. So
Okay, cool. Yeah, because one of the things we do is we're trying to track the relationship between air quality and temperature, like heat,
mhm,
and they
yeah.
kind of interact with each other. Okay, great. Thank you.
We we do have temperature data that we are attempting to um, rework. So that way it's a little bit the the query that did exist was we didn't find that helpful. So we are reworking temperature data. And so when that's up, we can definitely send out a kind of a reminder, a newsroom item saying that a new um, temperature, because we used to have temperature and precipitation, but we're reworking them so that way they're more useful. So they'll be up soon.
Great.
And then I'm going to toggle back home to the landing page. We talked about there are other ways to view data. So um, another way would be to look at indicator reports, and you're going to navigate in a similar fashion. You'd click on indicator reports, we'll come to environmental public health tracking, and then again, things are grouped. These tiles correspond to either by health or by environment. Um, we can look at, we have ozone. We'll look at asthma, the asthma indicator report. So we click on asthma, and then we can look at either asthma ED visits, hospitalizations, or asthma prevalence. These two, asthma prevalence in adults and asthma prevalence in youth, come from a population survey. So um, we'll just look at asthma hospitalization. So what indicator reports are is they are a combination of kind of written contextual information and some static graphs, charts, and maps. So the queries allow a user or enable a user to have as much control over the data as we build into the data sets. Indicator reports are if someone maybe doesn't know exactly what they're looking for or just wants a quick maybe snapshot of the data. Indicator reports are a good starting place. Um, when you come onto an indicator report, you will begin on the overview page, which is where the written contextual information is. So there's a pretty general structure to all of our indicator reports, but they'll typically have, why is this important? A definition, which is typically associated with like what the medical diagnosis codes are. A current outlook. We are working on updating these, but kind of how are we doing? How does New Mexico compare to the US? What is being done? And this is typically through the lens of like, what is the state of New Mexico doing? What is the New Mexico Department of Health doing? We might be referencing some New Mexico Environment Department work, but it'll have some links to kind of partner organizations or other programs within the agency. Again, a technical notes section. This is very similar to that tab I showed on the query where it'll say, where did the data come from? How is it measured? What kind of issues may exist with it? For instance, on hospital inpatient data, all of the data we present is from non-federal facilities. So it does not include IHS and it does not include the VA, right? So that type of message is included on all of our hospital admission data, which is referred to as hospital inpatient discharge data. A kind of a nice part about the indicator reports too is we typically have the ability to link to other pages that are on the New Mexico Public Health Data Portal. So this would take us to a health topic page on asthma, and we'll look at what a health topic page is eventually, but then also has links and resources to other things. So we are working on collaborating with other programs in the Department of Health or the New Mexico Environment Department. We'll be able to add a more robust list of resources. But I'm going to scroll up. What is the other component of indicator reports are the charts and maps. So in queries, you have the ability to kind of select certain things. The charts, the maps, the tables, they're all dynamic. Everything in an indicator report will be static. You don't have the ability to kind of change the parameters. So everything in this charts and map tab that we're currently selected on underneath the overview is going to be the charts and maps, as the name would suggest, from our different data views, which are these 4 radio buttons in these 3 other boxes. So currently we're looking at the age-adjusted rate by county for New Mexico for a 5-year period, so 2020 through 2024. This is our map. And my table didn't load, so let's try to refresh. It should load. There's my chart, right? So this chart, the map, the chart are showing the same thing, but they're just different visualizations. So again, that 5-year period for New Mexico, we're looking at the age-adjusted rates by county, right? So then you have kind of a visual of how all of our counties compare. And again, the corresponding table, we have, again, the download button. So you could download this data. And if we continue to scroll down, yes, we'll then go to see more and more different data views. So again, so now we're looking at by age group, kind of stratified or grouped by sex. So purple bar being female, orange bar being male, looking at these 5-year age groups. We have our chart, the corresponding table. You can download the table. So there's our color, Stephanie. Purple, orange. Those are our primary agency
Beautiful.
colors.
Just,
yeah.
I think whoever picked him was colorblind, but that's just an opinion.
Yeah. And then again, so just everything's static, but these are kind of predetermined ways to look at the data. They typically are a lot of times groups of 5 years combined. So you'll continue to see that everything we've looked at thus far is the combination of 2020 through 2024. So a 5-year period combined. So this one's displaying the rate by count or by month. And then lastly, kind of a trends over time. So again, we're still on asthma hospitalization. So looking at the rate of asthma hospitalizations from 2008 and forward. Again, every table downloadable, footnotes, if necessary, included with all of our tables. And I'm on asthma hospitalizations, but I remember it also had ED visits. I just clicked the back to asthma reports and it takes me back to my original list of asthma reports. And again, everything has these kind of what I would refer to as these umbrella categorizations or umbrella categories, right? So cardiovascular disease or breathing problems is one we've looked at. And then navigating back to the home page, health topics. This is basically the opposite side of the spectrum of queries. This is going to be all written contextual information. Again, same navigation to this point. We get to the tiles. We have our umbrella categories. We can look at climate-related illness. We'll look at cold right now. We come to our cold-related illness static page or a health topic page. We have these, I think they call them accordion menus, but we have all these kind of overarching categories that we can look at stuff. So we can say, what is cold-related illness? We have a definition. We link to a separate visualization that we offer, which is our syndromic surveillance or our near real-time ED visit dashboard. So has a link to that. And again, you just continue to navigate down, open up each of these menus, and it just has kind of helpful information. So we go to who's at risk. We can look at health tips. And again, another kind of nice component of this is downloads or resources. So resources that people can download, links to other, again, national, state agency partners. We also have, if there is a related query data set, if there's a related indicator report, they'll also be on these health topic pages. We're on cold, but heat is kind of in the same kind of umbrella category. So from this page, we can click on heat-related illness. It'll take us to our heat-related illness health topic page. And again, it's got that same general structure. And we do have our health categorization and then our environment categorization. So again, clicking on any of these tiles, it'll take you to any of our further pages. So kind of a good starting place to just learn more about what a topic is, maybe what's being done, find some resources. So this is also another good component of the portal where we can link to events, other resources, other community partners that are doing something, and try to like build up a kind of a almost like a directory of information. So we can continually update this throughout time. Our data, a lot of the data that informs the queries or the indicator reports is updated annually, right? So everything you see will most likely stay that way for a year. When new data comes available through our different Department of Health programs, we then update it. But the static content, although some of it a bit outdated, can be a little bit more of a living organic document, and we can continually update resources or things happening in the community. Which
Joseph, did
also,
you,
yeah,
sorry to interrupt.
no,
Was that, I think you kind of skipped over it, but did you have a section that was said it was like climate related? Was that in the indicator reports?
that was,
Uh,
this is health topics.
climate related illnesses.
Yeah,
Yeah, okay.
so homepage, health topics, our
Uh-huh.
environmental public health tracking, and then, yeah, climate related illness,
And what do you have in there?
heat and cold.
Okay, gotcha.
Yeah.
But not air quality, because that would be related potentially to
Yeah, so that
climate
would be
change issues.
under environment. We can look at air quality. We would have
Gotcha.
outdoor air, indoor air, radon, or fire and smoke. So if we looked at fire and
Gotcha.
smoke, kind
Hmm.
of its own separate. Yeah.
Great.
Yeah.
Thank you. And
Yeah,
yeah,
absolutely.
just I on the like on this, so this is all kind of information and details,
Hmm.
but I'm just thinking about different ways to use the portal so that there's no way currently the way it's set up to track like, well, I suppose there might be like incidents like asthma related hospitalizations and then try and triangulate around like large wildfires, for example, in terms of
Hmm.
just looking at the time period.
Yeah.
Would that be possible?
Yeah. So one method of utilizing this would be so if we go to query data sets is going to get again be your most robust way of the word I would use would be manipulating, but of interacting with the data. So if we were again, I think you mentioned specifically asthma. So asthma hospitalizations, um, which again could refer to either, depending on terminology, could refer to hospital admissions or ED visits. But um, typically, the smallest um, time component that we have on the portal will be month. So you would be limited to, you could select a specific year. So you can get down to, we know the wildfire happened in 2024, right? So I could say, I'm going to come to 2024. And then within 2024, I can say, well, it happened, you can identify the specific week, but it was in May and it was in June, right? But we might also be interested in July because it's a week or two after it ended, right? So then we can come to those 3 months. Um, we know that it was in, you might know the specific county, you have the ability to select that county, but we'll say it's just we know that certainly smoke can drift all over the state. So we'll just say we're interested in this kind of northeast corner of the state. And what it would do is I've filtered, but I'm going to show, I want to display by health region because I've selected a region, right? So it'll show that in that region, that purple region up top, that we had 29 visits during that specific time frame. So what you would do is having external information on maybe when that fire happened, or you have weather alerts about smoke levels, and maybe alerts on when to stay indoors or avoid outside activities. And then you can come and you can look at the count or accrued rate. When you do go from, we did all that work on count, that we selected a specific year, we did a specific months, we looked at a certain set of counties. When I do toggle accrued rate, my filters don't stay. So I just saw count, now I've come to accrued. I would have to go through that same process again to say, I want 2024, I want May, I'm kind of reducing it down at the moment, um, but again, you would have the ability to get close. And then one thing that we've typically maintained is, we try to provide a lot of data that's, you know, available at your fingertips, that people can get to. It's free to use. You don't have to have an account. It's a publicly available website. Um, Again, we do update it annually. If you get to a point and you're at a query and you're just not getting quite enough specificity, we do have, you know, someone can reach out to our program. You can reach out to any of our programs in the Department of Health, and you can submit a data request. And so we try to, enable or offer, as many tools as we can to allow someone to hopefully get to the information they need. But if it's still not quite specific enough, we still are here as public servants and can still assist you. So it'll probably get you close to that scenario that you were interested in, but if it's not quite enough, we can still have conversations about the capabilities of of the underlying data that exists. So
That's great. Thank you.
yeah. And I'm going to navigate back to the homepage. The last, out of these four major tiles of what's available on this portal, the last one would be county reports. Here is you'd come to county reports, you have a drop down, you'd select a specific county. The way that these county reports came about was that the health councils of New Mexico typically have to contribute to kind of community health planning, community health action plans. And so there was this general interest from a lot of representatives of counties or people interested in their county about how they compare. And so what the county reports do is they have kind of a curated list of indicators, and they'll provide, for instance, if we're looking at again, I'll try to stick on some of our heat or climate related ones. So like heat related illness, hospital admissions for 2020 through 2024. This is the rate of Bernalillo County. This is the rate of New Mexico. How do they compare? Right? They're similar. Right. And so this is just again, kind of like a quick snapshot. It's not inclusive of all indicators. It's not completely comprehensive. It's a curated list of items, but it provides a snapshot for someone who's interested in how their county relates about their county, the New Mexico rate. How does it compare? And what you can do on any of these is these are hyperlinks to our indicator reports. So we're on our county reports, but if I click on any of these purple tiles, it'll open up a new tab. It'll then take me to that indicator report. All right. So then I start with my contextual information, and then I have my different data views. So So there are a lot of things built into the site, attempt to link you to other pieces of information within the site. And I mean, that's, um, I think, again, if you need more data, as again, we're just in phase one. There is a phase two, so not everything is complete, but um, we do have, there should be contact us. That contact us takes us to our 24-hour nursing hotline. Um, do we have our about us? Contact us. Yeah, we have a way to contact there's me, our public health data scientist. We have the rest of our program, Chelsea Langer, our bureau chief, Jeannie Ruff, our program manager, our coordinator, our EPI, and myself. And again, our general kind of environmental health EPI bureau email for contact if the query is just not enough for you, or if you have any questions about stuff. So.